So we get a lot of families that have fled DV, so domestic violence, and a lot of children that are then displaced. And obviously, like Matt's saying, they get placed within a new city, often in accommodation that isn't really appropriate for a family, often one room, and they then begin the journey from emergency accommodation through into temporary accommodation, and that we found can be a really long time. To take a baby for an immunisation is then not a priority, because priority is then just getting through to the next day, or trying to survive in a one room, or struggling with their mental health. And sometimes the GP's practices will turn around and say that if they've been moved into another temporary accommodation, that they need to be taken off the list and re-register. And all of that takes time. That's what we've found. It just becomes a really lengthy process to try and get those normal things in place and actioned. And the surgeries are great, but there's so many patients that often they can slip through the net if we're not there trying to make sure that they come back on board with those universal appointments that need to be taken.